Estimates indicate that 10% to 15% of the population in industrialized nations is affected by tinnitus, a condition for which there is no definitive treatment. Customized acoustic therapy is an emerging treatment for tinnitus that, in theory, targets the implicated neural pathways. A prospective study by Australian researchers, published in Clinical Otolaryngology, examines a novel, web-based form of customized acoustic therapy for patients with tinnitus. The theory behind the treatment is acoustic desensitization. Patients self-select the frequency of their tinnitus, and the platform produces a matching sound. John Charles Hodge, MBBS, MA, MRCS, FRAX, explains. They then play back the treatment sounds during the day or at night to train the brain to ignore them. During the trial, 58 participants underwent 6 weeks of the customized acoustic therapy, which was delivered for up to 2 hours each day on a smartphone, tablet, or computer and integrated into their normal daily activities. Our goal was to incorporate digital technology and platforms into tinnitus therapy so that patients in more remote communities who have difficulty getting face-to-face appointments could benefit from this type of care, Dr. Hodge says. A novel 5-question tinnitus scale called 5Q was administered to at baseline and each week of treatment to assess efficacy. The impact of tinnitus on sleep, concentration, relaxation, hearing, and activities of daily living are graded on a 100-point scale. Standard QOL questionnaires for tinnitus are long and clunky, so we developed a shorter version, which has been correlated with the other validated instruments, Dr. Hodge notes. Improvements based on tinnitus duration severity. Most of the participants were male, N equals 43, and the age range was 55 to 74. In 49 individuals, tinnitus was bilateral, and 39 reported hearing loss. One of the surprises for us was that, in some people who reported high-frequency hearing loss associated with high-frequency tinnitus, the hearing loss resolved after acoustic therapy, says Dr. Hodge. Improvements in symptom severity scores were seen in 67.2% of participants, while 6.9% had no change and 25.9% experienced a decline from baseline. Figure. The researchers observed a trend toward better results in patients who had tinnitus for less than 10 years, although responses also were seen in a significant percentage of those with symptoms for more than 10 years, 83% versus 60%. The same was true in all groups with mild to catastrophic tinnitus. For those with slight tinnitus, no change was reported. When examining the impact of tinnitus frequency in relation to outcomes, the authors found that response to therapy was significantly better in participants with tinnitus frequencies of less than 2000 Hz, p. Cervical spine dysfunction is key in these patients, says Dr. Hodge.